everyone. Welcome to this session of the Local Foods College. So I'll just give a little bit of background about the Local Foods College before Annalisa starts. So this is something that the Regional Sustainable Development Partnerships, which is part of Extension, have been doing for many years now, usually in the winter, focusing on various local foods topics. And so this is kind of a special session that we've pulled together to address COVID-19. And I know there's just been like a flood of information, but sometimes it's really helpful to like hear it from the experts and to just have the space to ask questions. And so that's what we are going to be able to do today with the topic of food safety. I just put a slide in here to show some upcoming sessions we have. So on Thursday, Kathy Zeman from the Farmers Market Association is going to talk about farmers market responses. Next Tuesday, Ryan Pesh, who is both a farmer and an economist with Extension, is going to work with David Van Eckhout from the Good Acre to just talk about crop planning and kind of like farm planning in a really weird time where it's kind of hard to predict what markets are going to look like. On the 16th, MDA and the Minnesota Grocers Association are going to talk about some of the work they're doing to try to help shift wholesale markets for folks who have maybe had markets canceled. We are also potentially leaving this open for more sessions if there are things that you still feel like you have questions about and you're not finding answers to those things. After this session, Anna's going to send everyone like a little survey evaluation, and that's a space where you can request or recommend future topics. So today we're talking about food safety and just a couple of bios. So Annalisa Hultberg is going to do the bulk of this presentation. Annalisa is a statewide extension educator working with food safety at the University of Minnesota, where she coordinates the On-Farm GAPS, which is Good Agricultural Practices Education Program. She's worked here since 2011, providing science-based farm food safety education to farmers around GAPS, as well as the FSMA produce safety rule. She works with small and large-scale farmers from to school programs, food hubs, agricultural professionals, and others to provide outreach and technical assistance to ensure safe, healthy supply of local food through the use of GAPS. She's also the state lead for the North Central Region's FSMA Training Center and leads Extension's outreach activity around FSMA. Valerie Gamble from MDA is also joining. We thought it was really important to have someone who could provide kind of some regulatory context. So Val has worked for MDA for 11 years and manages the statewide program related to farm produce safety practices and implementation of FSMA, the produce safety rule. Valerie has worked as an inspector, a supervisor, an outreach coordinator for MDA, and prior to that worked in California farming and also doing agricultural extension research. So she's kind of got all the different types of experience as a farmer as well as with food safety. So she has a master's degree in geology and also studied climate change for several years. And I guess I'm also going to be presenting a little bit. So I'm a statewide extension educator. I work with local foods and vegetable production. So I work with farmers of all different scales on all different production related topics. So with that, we're going to switch over to Annalisa's slides.
All right. Good afternoon, everyone. Thank you. And thank you to RSDP for getting this together pretty quickly. There has been a lot of interest in this, obviously, as we know. And so kudos to everyone for organizing this on the fly. So like Natalie said, Annalisa Hultberg, I've worked for Extension for a few years, and that was in another college, CFANS, at the university before that. So I get to work with fruit and vegetable farmers around on-farm food safety and good agricultural practices around the state. So I will be kicking us off here. So some disclaimers: we are not healthcare professionals, we're not epidemiologists or attorneys. We've synthesized some of the most pertinent public health information that we know about this disease right now and the virus, and we're hoping to share that with you today. But there will definitely be some questions that we're not able to answer, partly because, as we know, what we know about this virus is changing rapidly by the day. So we're doing the best to give you what we have to date, but you will definitely have to stay tuned in the future. We will keep track of those questions. I'm also seeing this session as a great way to elicit information as well as provide it to you. So use the chat function. Even if we don't get to it today, we will use that to guide future programming, fact sheets, FAQs. I'm seeing a lot of those kind of things lined up for this summer. So we will be providing you with those after that. And then also just remember that if you're a farmer, you might already be doing some pretty good practices, good agricultural practices, fall in line with minimizing viruses and transferring viruses on your farm. So you might already be in a good place there. So our agenda today, just a glance, it's probably more than we should have tried to tackle, but we're really going to try to focus on the virus, what the virus is, just so you have a little bit more context about how to minimize it on your farm, how it's transferred, what we know about how it, the most likely modes of transport are, and how we get sick from it, and what are the less likely ways to get sick from it. Then what that means for your actions on the farm. So given what we know about it, what are the things that you should be prioritizing given relatively, small amount of time? Sanitizers, cleaning and sanitizing, and then really importantly, a lot of the workforce considerations, labor issues, and employee training. And know that, of course, this could probably be its own webinar and could definitely be in the future as well. So some of the basics that we do know. So we know that COVID-19 is a respiratory disease, like influenza or other respiratory diseases. It's caused by this novel strain of coronavirus, the SARS-CoV-2. It has animal origins. We know that as far as we know, it is new to humans, so we don't have any known immunities, we don't have vaccines, and we don't have any known therapies that can cure it right now. We also know that there is no evidence that COVID-19 is transmitted through food or through food packaging. And so that's different than a foodborne illness that good agricultural practices and some of the other practices that farms have been doing for years are set to minimize. This one is not likely transported through food. That's not to say it can't happen or it hasn't happened, but it's not the most likely way that people are getting sick through it. We also know that it is a lipid-enveloped virus, and therefore it's less stable. So a virus isn't alive. It really is just some RNA, some genetic material that has a protein capsule around it, and then a lipid, a fat envelope around that. And that fat envelope, if you picture like grease or oil on your dishes, when there's detergent on it, it disperses really quickly. It really breaks it up quickly. So in some ways that's good because this virus is more, it's more easily inactivated by things like soaps and sanitizers. Hand sanitizers are effective against it, as opposed to something like a non-enveloped virus like a norovirus. If you've ever had a norovirus, that's that GI, vomiting for 2 days. Those are not, a norovirus is not easily controlled through things like basic sanitizers. It can be, but it needs to be a higher disinfection rate. So that is perhaps a good thing about this virus. So we know that it is primarily spread through respiratory droplets in the air when a person coughs or sneezes. Like I said, it's a respiratory illness. I mentioned that, right? It's important to mention because it matters for its control. So things like bacteria are like E. coli, Salmonella, Listeria. These are foodborne, and also the other thing that they are different from viruses is that bacteria can replicate in their environment. So if you sprayed some water on your lettuce that had some E. coli in it because it was contaminated with fecal materials, it would, in the right conditions, those bacteria could grow and they could replicate, and you could have more and more of them, and you would have even more of a problem. With viruses, that doesn't happen. They need to go into the tissue of that living person or animal, and that they go right into that host, and they inject material into the host cell, and then they can start replicating. So it has implications in that in some ways they are easier to control because they are not replicating outside of their host. I already said those other things, so I won't repeat those. So how do we know about how it's spread? We know from the epidemiology out of China that it is spreading very rapidly in families, in hospitals. We've probably all read stories in the media of people in close confined spaces. Any big public gatherings is how it's spread, and it's because of those respiratory droplets. When people talk, when they breathe even, they can make each other ill. So that's why we are not gathering right now. So this WHO paper has laid out kind of the three primary modes of transport that happens in respiratory illnesses. So we have the larger drops. Picture a larger bit of spit. I mean, you might be able to see it, you might not be able to, but it's still relatively large. Maybe someone's talking to you from a few feet away or even closer. That's a droplet, and that's probably the way that most people are being infected by this disease. Then there's airborne, much smaller aerosolized particles that might actually be suspended in the gas in the air. Those can linger for a few hours. Their research is still out about how important those are in transmitting the disease. It's probably a lot less than those droplets. So some people think that the airborne aerosolized particles might be a culprit. Some people say no, and that's probably going to be primarily in a hospital setting though. And then the third would be those surfaces. So someone sneezes on a picnic table, I then walk by that picnic table, I put my hand in that sneeze particles, I then put my hand into my eye. But remember, it is a respiratory illness, and therefore it does have to get into my mucous membrane. I can't, it doesn't go in my hand. So that surface transmission requires a few more steps. So this is a graphic depiction here. You see that there are the close contact, that one at the top there. So that's the person on the left is the infected person, and they are talking very closely to the person on the right within a few feet, and that spit, that spray, that cough might be coming directly into contact with the mucous membranes of the person on the right. That's the primary mode of transmission for this disease. Airborne would be those aerosolized particles, probably a lot less important, probably most important for a hospital setting where it might be happening when we're doing intubation and other sort of medical procedures that causes the aerosolization of those particles. And then the last would be those fomites, those surfaces. So again, those fomite surfaces might transfer the virus, but again, it's kind of diluted, so to speak, because the person, the droplet, once you sneeze, is going to dry out a little bit, it's going to land where it then continues to dry out more, and then someone's hand has to go into it, and then they have to get it into their eyes, nose, or mouth. And so the amount of actual infectious viral particles at the end of those chains of events is likely to be just frankly less than someone standing next to someone else and the sneeze goes right into them. So this is repeating what I just said, that as far as we know, the epi data coming out of China and looking at how this virus has spread, this is coming out from the WHO and the CDC, is that it really is the transmission person to person. It's not to say that those surfaces and those aerosolized particles can't be culprits, but probably less important. So this is a perhaps oversimplification, but just in terms of prioritizing people's efforts, keeping people away from each other needs to be the top tier, and not working when you're sick, especially if you're sneezing or coughing, because that is how those things are spread. That table that you might have at your farm somewhere that may or may not even be touching anything related to food could potentially be a vector for the disease, probably lower down on that risk level though. So how do we know about how long it can last on surfaces? So This is a very new virus, a strain of coronaviruses. So there hasn't been a lot of research here, but this preliminary data showed that on hard surfaces, stainless steels or plastics, 2 to 3 days, there was a 4-log reduction. So basically 99.9% of the viral particles were dead after that much time. Cardboard was about 24 hours, copper was 4 hours, and in the air, suspended in the air, was about 3 hours. So that's not to say that there was infectious particles at the end of that time. So if I sneezed and I had it and I sneezed on some stainless steel, 3 days later, they could detect that there were initially some viral particles on it. It doesn't mean that you could necessarily get sick from touching that. And my understanding is that after a few hours after they inoculated the surface with the infectious particles, after a few hours, the vast majority of it has died down. So some hours is probably how much time it might persist on a surface, but it really depends how much was there initially. So that's why when some people are looking for really kind of hard and fast guidelines about how long will it last on our tote or our cardboard box, it's kind of hard to say a hard and fast number, because if there was a lot to start with, well, it could take a number of days. If it was a tiny little bit, it could take 1 minute. So that's why things like hand washing and basic cleaning and sanitizing, just as a matter of course, are really your best bet. So we'll go through those. So we're already doing things like good agricultural practices. We're already minimizing the spread of bacteria and viruses around our farm by testing our water, by hand washing, doing our best to keep domestic and wild animals out of the field, cleaning and sanitizing our food contact surfaces and our frequently touched surfaces around the farm. So we're not going to stop doing those things. Farmers have been doing those for years, and I certainly hope no one would stop doing those, because if we had some sort of a foodborne outbreak on top of this, that certainly would not be good for our healthcare system right now. But given that we know how that virus spreads, we can kind of think about, oh, okay, well, those high touch surfaces around the farms and hand washing is going to become even more important. But the good news is really the things that, those farms that have been doing GAPS for years are already really well set up to control the virus on their farm. So given the things that we know about how the virus most likely spreads, here is a list in vague order of priority of how it might be suggested that you approach this on your farm. So given that person-to-person contact is the way that we most likely think that this virus is transmitted between people, employee training becomes extremely important. So letting people know that they should not come to work if they're exhibiting any of the symptoms of the disease is probably the most important thing you can do. And that would hold true for volunteers and for visitors as well. Use the resources that exist. We have links to a number of them in this presentation, but web searches CDC has done an excellent job of making really good posters. They're in a number of languages, those kind of things. So that social distancing, literally just keeping people apart. If the majority of transmission is happening when those bits of snot hit you, if you're farther than 6 feet away, it's going to be very difficult for those bits of snot to hit you. So that's why we're keeping our distance. Hand washing is very important to stop the possible transmission. So remember the fomites, the surfaces, you can't transmit it if there's nothing picking it up and putting it in your eye. So that's why we're washing hands so frequently. The other thing to remember is that they think possibly even more of us can be asymptomatic carriers. So it can be a number of days before you show any symptoms. The symptoms might vary. So just having as a part of your routine frequent hand washing is going to be a very good idea. Really keeping your hands out of your face and nose and mouth. That's extremely important to slow the spread of the disease, and then cleaning and sanitizing those surfaces. So we'll talk through some of those. Recognizing the symptoms of the illness. There's a couple of posters next from the CDC, but just talking through with your employees about what it looks like, and knowing that it might look different in people. We're hearing reports of all sorts of different symptoms, but almost all many of the cases have a fever, have a cough, and you know, these are some of the main things that you're going to be looking for. Body aches, not working when you're sick. This can be difficult because employees need to earn money and you need them to do the jobs that you've hired them to do. So that's why thinking about slowing that curve is so important. Flattening that curve is so important to communicate early on that it will be an investment early on and a difficulty, but it's better than getting more people sick in the long run because someone came to work sick. So it will be difficult, but it is the only way to manage this illness. And then hand washing, having enough hand washing places and telling them where they are and telling them when you expect them to do them and leading by an example. If assuming you are the farm manager, you are the one also washing your hands very frequently. Somehow limiting contact between people, and this also will be challenging on the farm if there's crews, but just thinking through your operations to try to maximize that distance between people, open and honest communication, letting people know that you will listen to their concerns and you won't be angry at them if they tell you that they're sick. Tell them exactly how you expect them to clean and sanitize. And then if you have any sort of policies about sick leave, communicating that. So CDC, like I said, has some excellent resources. There's more available from there, but these are all COVID specific. So they've done a nice job of kind of getting those out quickly. Other ones. So social distancing on the farm is going to be difficult like it is everywhere else, especially perhaps in the greenhouse or other sorts of, you know, smaller space with a lot of people in them. But again, communicating early on about how serious that disease is going to be helpful to help people. If they all have the buy-in, they might be more helpful in coming up with strategies. So some ideas is using Zoom and FaceTime, group chats, other ways to communicate without in-person contact, really trying to have volunteers at a minimum or at least having them in separate places on the farm and trying to overlap their groups with others. Hopefully putting it all into standard operating procedures, having it at some point in the next few months kind of organized and documented into a plan that you have, and you have that organized and written out. So we'll talk a little bit more about those, some ideas there at the end too. Hand washing, it's important to remember that it really has to be done well, especially in the farm environment. Our hands can be pretty dirty. So a good 20 seconds, especially tell people when you want them to wash their hands, and especially after they've blown their nose or coughing or sneezing or anything. Make it easy, make those hand washing sinks where the people are, make sure there's one right outside of the bathroom, and make sure that it's well stocked and functioning. And signs can be really helpful too. And remember that a sanitizer is effective against this virus. If you do want to choose to use it, that's fine. Make sure that those hands are not visibly dirty though. So in the farm environment, it probably, sanitizer wouldn't be, I can't see that many uses where it would be great. Maybe after washing your hands. It's useful in like a hospital setting or something because their hands are already pretty clean. There are some ideas there for stands that people have built. And here are some things that every hand washing stand has. So it has water, it has flowing water, it's not just a bucket. It has soap, it can be liquid, it can be a bar, it can be antibacterial if you want it to be, it certainly doesn't have to be. Bucket to catch the water that it goes down into, you don't want it just pooling all over the place. And some sort of single-use towels. If you wanted to use a cloth towel, you could. You would just have to launder those after every use, like a little washcloth, or a paper towel that you then compost or throw away, that's fine. And then a garbage can to hold the paper towels in. So having those around your farm and having them well marked will go far in helping your employees wash their hands as much as they need to, so that they don't have to walk across the entire farm. We made a fact sheet on how to build them, and those are available for download. And there's 6 other fact sheets on there as well. One of them is about cleaning and sanitizing that might pertain to this topic. Hand washing signs are everywhere for free on the internet. You can just write them if you want to, but there are certainly a lot of signs out there. So cleaning and sanitizing the tools and equipments and bins, I've gotten a lot of questions about this, but going back to remembering that those surfaces are not the most likely source of transmission of the virus. That's not to say that they can't be, but so the basic recommendation is just keep on cleaning and sanitizing your bins as you had prior to this pandemic. You might want to step up your game if you don't have a great program with that. And then also, this will probably pertain to everybody, start sanitizing those high touch surfaces like those doorknobs, those phones, handles, toilet handles, those kind of things that aren't necessarily getting dirty with soil and debris, but they might have viral particles if there's a carrier, an asymptomatic carrier, even around your farm. So using a wipe or using your sanitizing solution on those high touch surfaces would be a good idea right now, and hopefully relatively low time investment. So the exception here, so the basic cleaning and sanitizing, but then if you have a documented or a probable case of the virus on your farm, then you would implement another level. So then you would contact your public health department. Then they would give you guidance as to cleaning and disinfecting, and it becomes a different level of approach. So before, it's more of a prevention. And then that would be a disinfection, and it would require a lot more thought. But right now we're just talking about those basic prevention that everyone will do, assuming that they don't have a documented case on their farm for now. So the sanitizing of the tools and surfaces, remember that you have to clean before you sanitize. So if I had a table and I had been sorting a bunch of produce on it and then had a bunch of mushed up tomatoes and things, and I sprayed my bleach solution on there, that bleach solution wouldn't do anything because it needs to be cleaned first. So that sanitizer is meant to be just kill the last remaining infectious organisms that might be on that table. It's not meant to actually get rid of those tomato junk. So first we have to brush or rinse off the large debris, and then we scrub it with some sort of a detergent like a Dawn or some other sort of detergent that you like, and then you rinse with potable water, and then you spray your sanitizing solution on there. So if you had, again, like a door handle, you probably wouldn't have to do all those steps because I'm assuming your door handle isn't covered with dirt. Although if it is, then you should probably clean that before sanitizing it. But assuming that some of those high touch surfaces like your phones and things aren't actually covered with visible debris, probably just the sanitizing step is okay. Maybe occasionally a cleaning step as well. It's important to point out that difference between sanitizing and disinfection just because those terms are thrown on a lot. So the sanitizing is the reduction of the infectious organisms by 4 logs. So we have a lower parts per million rate on the label, and it's killing most of them, and it's adequate for our day-to-day prevention and our day-to-day activities. A disinfection would be more of a hospital rate, or if you have that known case. So that would be that higher ppm as following the label, that higher rate, and then a longer contact time, almost always a longer contact time as well. But you don't want to just kind of go to that disinfection rate. It's not, you can't use that disinfection rate on a food contact surface. It's often a very high level of chemical use. So more is not always better. So don't just start using that real high rate because you think that it might be necessary, because that can be not good for your health, or it could be an off-label use if you were putting that on a food contact surface. So that sanitizing rate should be adequate for your day-to-day prevention. Here's a graphic depiction. First, we're getting rid of the visible debris, then we're spraying with some soap water, then we're scrubbing, rinsing, and then spraying with that sanitizer. So what are some of the things that we're advocating the cleaning and sanitizing? Again, prioritizing those really high touch surfaces, doorknobs, handles. For other things, your basic cleaning and sanitizing routine is probably okay. I mean, that kind of depends on what it looks like right now. And we'd be happy to help review your food safety plan and kind of think through. Often totes, if they were going out into the public and coming back, I think it would behoove you to do the cleaning and sanitizing step for them and letting them air dry. You know, your tools, a lot of people, if it's a tool that's going to touch the edible portion of your fruit, of your produce, if you're trimming something and then that actual blade is going to touch the food that someone's going to eat, it really would be a good idea to sanitize that every day. Also, that kills the plant diseases and other pathogens that are spread around the farm. So that's just kind of a part of good agricultural practices as well. So there is no hard and fast rule about, you know, all totes must be sanitized every day. That's probably not realistic. I mean, people have 200 totes. So cleaning and sanitizing all of those every day would probably not be realistic. But maybe you have some that go out to the public, and then when those come back, they're sanitized. You have others that stay in and then in-house, and then you develop a way to kind of separate those, maybe by color, and then the ones that stay in-house, you rotate through and sanitize really based on your own risk assessment and what's been in them and who's been touching them. The EPA has given us this list N, and it is a list of disinfectants that are approved for use to inactivate the SARS-CoV-2 virus. So it has 350 disinfectants currently listed on this list, and you can sort it by name. If you want to see if a disinfectant that you use is on there, probably the easiest way is to put in that EPA registration number, which is on the product itself. Products have a lot of different names, or you could also just search by the name. But so those are the ones that we know are going to deactivate the virus. Some of the products are on there. They're not listed for coronavirus, but they're known to kill things that are even stronger than coronavirus. So EPA has put those on here. There are options, commonly used options like bleach. CDC is recommending 5 tablespoons per gallon. That's 1,000 ppm. Of course, the bleach needs to be no fragrance, no thickeners or anything like that. Sanidate 5.0 I put on here just because this is a frequently used sanitizer in a lot of farm settings that people mix into water and then spray as a sanitizer for their food contact surface. It is not currently listed. I want to be clear, it is not listed on that list N, although folks that I've talked to around the country right now are kind of struggling and trying to work with the EPA to say, okay, well, it's not on there, but it definitely is expected to kill the virus because it uses the same active ingredients, this peracetic acid and hydrogen peroxide, that are in other chemicals on this list. So, I can't say it will absolutely be effective against the virus, although we have no reason to think that it wouldn't be. And I will definitely be continuing to work with our national colleagues to try to get more clear guidance on that, simply because it's so commonly used. It's OMRI approved. It's a lot of people like using that as a sanitizer. But to be clear, there are many others that are on the list that are approved for use for the chemical. But absolutely follow the label and wear that personal protective equipment, because even things like the Sanidate 5.0, when at full concentration, can burn you, can really give you a contact burn if you touched it. So be careful with it. So masks, Natalie, would you like to talk about masks?
Sure. So masks are really complicated for a few reasons. You've probably seen this kind of back and forth about, like, should we be wearing masks in public? Should we not? And the CDC is now recommending that all Americans wear cloth masks in public. Keep in mind that, like, wearing a respirator or a mask for like 10 minutes in a grocery store is a really different experience than wearing it while you're working on a farm. So some general tips are: make sure you're washing your hands really well before you put it on, because when you put it on, you're going to be touching your face. And the whole notion of not touching your face becomes really complicated. Again, if you've only got it on for like 10 minutes, you're in a really public place, it makes a lot of sense, but they are inherently uncomfortable. And discomfort versus getting a virus is obviously nothing to compare. But the problem is that when you're uncomfortable, you're going to be touching it and you're going to be adjusting it. I worked a lot with respirators in the context of commercial pesticide applicators, and that was always the finding, that people end up touching their face and then they become more exposed. Also, there is a lot of good research showing us that when people have PPE on, so when you're wearing a respirator, you feel this sense of protection that may lead you to do less safe things. And that's not because you're not a careful person. It's just basic human instinct that you feel like, oh, I have this protection, so maybe I don't have to stand 6 feet away from this person. I can get a little closer. And especially since these cloth masks that we have access to right now are not N95s, they're offering very limited protection. The risk that you're gonna kind of get into this accidental mindset of like, oh, I've got the mask on, so I don't need to be as careful. But especially the risk that you can be touching your face because it's uncomfortable, especially if you're working in the field and you're sweating, it just poses a different kind of risk. And so it's something to definitely weigh. And I would say, like, think about the situations you're going to be in. If you're like at a farmer's market and you're interacting with people, maybe that mask will help you feel more comfortable. If you're like at a team meeting, maybe that's a situation where you want people to wear masks. But I think when you're in the field and you're actually doing work, as long as you're staying away from each other, like maintaining that social distance is going to be a lot more effective than encouraging people to wear masks. If you do wear masks, make sure you're washing it every day. Most of the masks that we have access to right now are masks that you're going to have to wash. If you had an N95, that's disposable. You're supposed to get rid of that at the end of the day. But I don't think any farmers have access to masks right now or to full N95 respirators, since those are going to hospital professionals. So it's a little complicated. Just keep in mind that by wearing a mask, you may be introducing different risks.
So this kind of gets into, so now if you have a confirmed case on your farm, it becomes a human health issue, and you really do need, your first step should be to contact the Department of Health. Our Department of Health has some pretty good guidelines that they're developing. The CDC also has some really great guidelines about disinfecting and how long you have to wait before that person can come back in. But you're just going to have to work with those agencies on that. Val, did you want to add anything to that?
I think a lot of that information has been nicely pulled together in that resource that we have in here, so can just touch on that.
Okay.
Which is right there. I think it's the next one, but I wasn't sure. So there is a new resource that actually several state agencies helped put together, MDH, Board of Animal Health, MDA, and it's posted on the MDA website. The link is on the screen. Apologies, I know our links are very long, but you can find this fact sheet and many other fact sheets related to COVID-19 and agriculture on the MDA website. We have a special page set up just for COVID-19 related to ag. But this particular fact sheet, this preparing for sick agricultural workers and COVID-19, goes through what you can expect if you have someone who is actually diagnosed with COVID-19 through a lab test. The Department of Health will do an employee interview with that person, and they have recommendations in this document and also online about what that person should do, which is, I think, what we've all been hearing, that 14-day self-quarantine, of course, depending on the severity of the case. It goes through what you should do if an employee is ill with symptoms of COVID-19. There are quite a few guidelines, or there's quite a bit of guidance given in that space. How do we decrease the exposure overall, and then what can employees do to reduce the risk? Basically summarizes what Annalisa has gone into in great detail here. So maintaining that social distance, eliminating that person-to-person spread as much as possible. That's really what this fact sheet suggests. And then they also suggest that employers make redundancy plans for essential employees just to make sure that you can continue doing animal care and feeding and things that really can't stop on even a daily basis. And there is a link on this fact sheet as well to the CDC guidance for cleaning and disinfecting your facility, which goes into great detail about different surfaces and different environments and what you might want to do to kind of go through those disinfection processes. So it's a good resource. It's online. Again, kind of summarizing a lot of the information that has been produced in this space so far.
Great, thank you. Natalie, do you want to tackle this?
Sure. So Annalisa just did a really good job of presenting the facts of what we know. How that gets implemented is going to end up looking a little bit different on every farm because every farm is different. But communication ends up being probably the most important piece of this. Something I think is really important to think about is that every single person is going to have a different tolerance for risk. So if you are immunocompromised, or if someone in your family is immunocompromised, you're probably taking this a lot more seriously than some other people are. I think in general, farmers probably are taking this pretty seriously. But we've been on calls with people who are at one end of a spectrum, like spending hours and hours a day sanitizing, and then other people saying, we're in a rural area, we don't think it's going to come out here. And I think that people have maybe shifted towards the more conservative end of that spectrum as we've learned more. But just keep in mind that, like, if you are a farm manager and you put out this great plan, if people who are working with you are not on board or are not like taking it as seriously, that's going to have implications. And so just trying to have really open and honest communication is really key. Some of these conversations might be awkward. You might be having conversations you've never had before. But think about things like, are any of your employees particularly high risk? Maybe someone lives with someone who's a healthcare worker, or another, a person who's in contact with a lot more people. Just seeing how your employees are feeling. Basically, like, by doing all this, by having these conversations, you can kind of identify, like, are there certain people who are at higher risk, and maybe those people end up doing different jobs where they're further away from people, or you can kind of work it out accordingly so that you know that everyone is on board with your plan. Oops, can you go back a slide, Annalisa? So I think we talked a lot about this already. Making sure that people are 6 feet apart is going to be really tricky in certain situations, but do your best. Consistent signage to remind people of what your plans are, as well as visitors, especially visitors. If you have visitors on your farm, putting signs everywhere, as well as like communicating through social media or all of the different ways that you communicate with people who are showing up to your farm is going to be really key. Annalisa, do you want to add anything here?
Not really, other than I definitely see this as being something that we would love to crowdsource and to work with farmers over the next probably month or two, and develop strategies that farmers are using to do this, because it's not going to be easy, but it's going to look different on every farm. So there really isn't one answer. So I think I definitely I can see us gathering ideas for this and putting it together and sharing with people. And I can talk about these. Kathy sent me these photos. I don't have any photos from farms doing social distancing yet, but at farmers markets, the left was in North Carolina and the right was here in Minnesota somewhere. And at farmers markets, just the 6-foot lines. So if this was a CSA pickup or this was something else, just thinking about those physical lines that we've all probably seen at the grocery store by now, and just making that kind of the new norm.
So this is something that has come up a little bit. So as Annalisa said earlier, this virus really spreads in closed, confined spaces. And you may be in situations where your employees or you are in closed, confined spaces with each other. I think this is especially true for farms that are using the H2A program. Often employees are sharing housing. And so it can be really, really challenging to find ways to socially distance, especially when everyone's living together. Again, if you think about everyone has kind of a different threshold for risk, and if one person's not taking it seriously and they're like going out and not being careful when they go grocery shopping, suddenly like a lot of people are infected. And so just a couple things that we brainstormed with larger farmers. One idea was to create teams as much as possible. So if you have employees in multiple houses, think about like those people are already exposed to each other. And so can you also mimic that on the farm where those people don't basically come into contact with the other teams at all? That's one idea. If people are in the same house, hopefully, so we are hearing examples and the CDC is saying like, if someone is in your house who has this virus, if they can be contained to their bedroom and use their own separate bathroom, that's going to be ideal. It doesn't necessarily mean that everyone else in the house is going to get sick. Maybe that means like taking separate shifts, using the kitchen and like really sanitizing it between uses. So just doing whatever you can to keep people separate from each other, even if that means not every person is separate from every person, but you've got teams. The Migrant Clinicians Network has some really good resources. So if you are using the H2A program or if you have employees that are living together, check out those resources. And again, just putting in as many hand washing stations everywhere, cleaning and sanitizing regularly is also going to help. So this is something we've been getting some questions about, and we want to be really careful because we're not lawyers. But training backup people, Val alluded to this earlier. If you only have one person who can drive your tractor or fix your tractor, it's probably worth investing some time to train other people to be able to do that. Washing and packing, operating delivery vehicles, basically making sure that you have backup people who can do these really essential farm tasks. So figure out what those essential tasks are and whether you need to train people. And do keep in mind, so one example that came up in a call was that if people who have just been working on the farm start operating delivery vehicles because you have started to do home delivery or something, that may change the way that their overtime gets paid out. And so we are not really in a place to answer those questions, but Farm Commons has been putting out some really, really good podcasts about all of those questions. And so I really recommend listening to their podcasts as well as reaching out to them. We have also talked about sick leave plans. So like Annalisa mentioned earlier, one of the best things we can do is encourage people who are sick to stay home. That's really challenging when a person is depending on that income. If you don't have a sick leave plan, think about it. If it's at all possible to implement that. As Annalisa mentioned, like if you're paying one person sick time for a week, that may end up being worth it in the scope of like, if everyone gets sick, the implications could be a lot worse. And so Farm Commons, again, just did a really, really nice webinar yesterday about the CARES Act and basically the loan program that has come out of COVID-19, which helps farmers and other business owners to pay employees sick leave. And that's a loan that doesn't have to be paid back for about 6 months. It is a little bit complicated. And so I recommend watching the webinar to learn more about that program. And also Rachel, who did the webinar, was saying it's really important to apply really soon if you're thinking about that program. So pickup locations and drop-off locations, it's kind of the same principle. So I think we get a lot of very specific questions about like, this is my situation, what do I do here? And every farm, again, is really different. Your drop-off systems are different. Probably every single drop-off location you have, if you're doing a CSA, is going to be different from the next one. And so using a risk framework is really the best thing that you can do. Think about each situation, figure out, just kind of brainstorm what are all of the risks and what are ways to mitigate that risk. So the number of people, again, this spreads in close quarters. So maybe you can stagger pickup times. Maybe you can add more sites so that you have fewer people total going to a given site. Think about making people aware of what 6 feet looks like. So Annalisa actually kind of crowdsourced on Facebook what different grocery stores are doing, and people kind of reported what their local store is doing. And I think it's a good analogy to like a CSA drop-off site or farmer's market. There's not one perfect policy that fits everybody, and everyone's taking it seriously to different degrees. So there are grocery stores that are limiting the number of people, others are not. There are grocery stores that have put plastic tape or like duct tape on every single floor surface and indicated 6 feet apart to really help people figure out what that looks like. Thinking about those high touch surfaces. So are people having to like put their hand on a doorknob and open the door? Are they having to pick up a pen and sign off? Just kind of think about all those different things where people might be touching the same things or coming into contact with one another, and basically do your best to minimize that. So this is a framework that David Van Eckhout at the Good Acre actually shared with me. And we've been using this from like an insect and disease management perspective, but I think it works really well in this context. So part of the struggle with all of this is there's just so much to think about that it's really hard to prioritize what to do first and which policies are worth implementing. And so basically this framework is mapping the effectiveness as well as the amount of energy or resources it's going to take to put in a policy. And so for whatever situation you're trying to minimize risk in, maybe it's your pack shed, maybe it's the farmer's market, basically you can come up with a list of every single thing that you could do to mitigate risk and kind of map it out on here. So what are the things that are going to be most effective? And then what are the things that are going to be the easiest to do? And generally you can kind of start in that bottom corner, the bottom right corner. Start with the things that are going to be simple and really effective, and then kind of move your way up. And I think that's a really, just kind of really basic but helpful way to prioritize where to start in all of this, because there are so many things that you're going to have to think about and so many ways that it impacts your farm. So hopefully this is just one framework. You don't have to use it, but I find it helpful in kind of prioritizing where to start and what's really going to be worth doing.
Yeah, I could picture hand washing and employee training and telling your employees what, the symptoms of the disease are and what you expect of them in the bottom right, or, those things definitely do take energy. So not meaning to discount them, but they're certainly very effective. Val, do you want to talk about this new resource?
Sure. So as I mentioned before, we have been working on developing resources that are posted on the MDA website. This guide for farmers markets and vendors just came out yesterday afternoon, and we worked a lot with Kathy Zeman on this just to gather information about best practices from around the country as well as the markets that have been running in Minnesota. So it's definitely a group effort to try and just put out some guidance on specific things that markets can consider. Again, it's guidance. It's not us as a regulatory agency saying this is what has to happen. These are suggestions based on best practices that either have worked here or have worked elsewhere. So that one is also available online at this point.
And then Anna said that this presentation will be available in a PDF of this PowerPoint afterwards. So I put direct links to all of the COVID specific pages within each of these agencies. So our Department of Health, our Department of Agriculture, and then those public health agencies there. And I will say I have been, again, really impressed specifically with the CDC, but also FDA has a great FAQ page. And they're really easy to understand, but actually specific enough to be useful. So I think when in doubt, I would go right to them, try to sift through there. And then of course, extension. So CIDRAP is the Center for Infectious Disease Research and Policy. They have a number of, that's Michael Osterholm and others, they have a number of podcasts out that have been pretty interesting. So that's more the epidemiology of the disease and what we know about the disease there. I put a link to our extension COVID page, which is not specific just to farmers, but also the rural health and hunger implications and the kind of the broader picture about the disease there. And then the Upper Midwest Ag Safety and Health Center is a lot of worker protection. So they have excellent resources in terms of posters as well. They've always done great in terms of their communication tools, hand washing and signage ideas that you'll might have to change to meet your own needs, but they're a nice place to start. Our MISA has a great compilation, and then just want to highlight some other ones. So MISA, Jane Jewett does an excellent job of keeping that updated. So if you're looking for upcoming webinars, those kind of things, MISA has a great calendar and lists of and links to all of Minnesota specific resources. The Cornell Institute for Food Safety has a very nice and also frequently updated list of guidance and documents specifically for the food industry. It could be the processing side of things, but also the farm production side of things. And they also, for the foreseeable future, I think will be doing these office hours where they'll have virologists and others on in the food industry, and they can answer specific questions about the disease and how to control it. North Carolina State has done a really nice job because they have a really big team of faculty food scientists there that work specifically with farms. They have really good resources. And then United Fresh is an industry group that some of you might be familiar with. They have some specific guidance. Farm Commons that Natalie mentioned. And then the farm response plan samples. So a good next step that a lot of farmers are doing is to create a specific, so a lot of farms have a food safety plan, and that documents their policies, how they train their employees to wash their hands, how they manage manure on their farms, how they exclude animals, those kind of things. We know that this isn't a pathogen that is spread through animal feces as far as we know. So that wouldn't pertain to this, but people are gathering up their ideas specifically to COVID into a COVID farm response plan. So there are a couple of samples there. I can see that being another thing that we really work with growers on to create some templates in the coming weeks as well. But if you're looking for 2 samples, there are some. And I highlighted just 2 recent webinars. I know there are a lot of webinars, but there are 2 specific webinars for produce farms for really that would pertain to any farm, but they are specific to produce farms. And the link to that permanent listing for that webinar is there. So that's all we have. We do have time for question and answer. I think I would be fine if people wanted to unmute themselves and ask a question. I don't know why not. Or you could put it in the chat box.
Hang on, let me give everybody that right.
Oh, okay.
Okay, everybody they can unmute if they want to unmute.
Or feel free to write in the chat box the questions, even if we can't answer them today, but just the kind of things that you would appreciate to have materials created about from the university or the Department of Agriculture. No questions.
That's surprising.
that's okay too.
You guys just did a great job, that's all.
Well, the goal was really just to kind of synthesize some of that information that's out there. Like Natalie said, it's overwhelming, the amount of information we all get. So hopefully the PDF of this PowerPoint will be helpful. Those links will be helpful. And then we will just work with all of you going forward to try to create materials that will be most helpful to the needs. Because it's going to be a different summer. So kudos to all of you. Kudos to the farmers, because there's so much uncertainty right now. So whatever we can do to help.
Hey, Annalisa, I just wanted to add really quickly too that we're updating our produce safety page on the MDA website, also to highlight more COVID resources to link directly to University of Minnesota resources that have been developed and others too. So that's a place to watch for new resources as well.
So there was just a question about whether some of this information can be translated. So we're in the process of putting together a webinar similar to this one in Spanish right now. And we'll be putting out some information about that soon. I hope that I think we're starting to explore whether we could do something in Hmong. Unfortunately, we just have less capacity among our extension and also MDA staff to speak Hmong. I don't know if you want to add anything to that, but yes, definitely keep an eye out for Spanish resources. And I think we're going to be exploring how we can do a better job of reaching out to Hmong leaders.
Yes.
The only other thing I would add is that we are working internally to translate the fact sheets that have been developed by the Department of Agriculture. So that's happening right now. We're hoping that we can get those out here within the next week or so, and then continue to do that if more fact sheets are created. But that's just the fact sheets, and I would agree having a webinar in more visual type of format would be ideal if we can work towards that. So.
Someone asked, is there any sense of impacted inspection timelines for certifications or new food producers?
So inspections in general are continuing. So I'm speaking broadly for the Food and Feed Safety Division of the Department of Agriculture. There are still inspection staff going out. We are trying to do virtual inspections or phone calls to just verify processes in some cases. Each situation is a little bit different. So I would say that's definitely still pretty fluid. We're trying to work with the information that's changing every day as well, to keep both the businesses that are being inspected and the inspectors as safe as possible. So timelines, there's potentially an impact for that. I will say, like within the produce program, that's something we're looking at as well. That's an ongoing conversation. New food producers, it's hard to say whether that would be longer or shorter. It really would depend on the situation itself. So if there are ever specific concerns about a business that seems to not be getting responses, I would say reach out to, our division directly, or the FIT team, the food innovation team, that handles issues or challenges that people run into when they're trying to start a new food business and they feel like they're running into challenges. So unfortunately, I don't have a lot of specific information that I can share in that space yet, but please do know that it's something that we're working through. And as Annalisa said, what we really don't want to see is a foodborne illness outbreak on top of the COVID-19 outbreak when our resources are already strained. So we're taking the responsibility as a regulatory agency seriously and continuing to do inspections, but also trying to modify that approach as much as possible, again, to keep everyone safe, because that's really the ultimate goal. So more to come on that probably. And hopefully that will be something that can be shared too through more of these webinars, because I know we're working on having people plugged in when it makes sense to share those messages too.
So another question was, how do you exchange money 6 feet apart at the farmer's market? Do you want to take that on, Annalisa? Should I respond?
I would just say that, yeah, the Minnesota Farmers Market is, I mean, so their association is having weekly office hours, and they've had a couple of webinars on their alternative systems that they've set up. So you okay, sorry, I don't know what happened. I think, remember, it's risk minimization. So there still might have to be contact between one person who's the money handler or gatherer, perhaps a card, they have the square reader, and the customers, but still it's still far fewer people than, I'm picturing a drop-off situation or a pickup situation where everyone was getting a box, as opposed to everybody mingling with everybody else at a farmer's market.
I would also add, this might just be another thing to worry about, but in many parts of the world, people don't exchange cash or cards at all. Think about apps like Venmo or those sorts of things where you can exchange money without actually having to touch each other. That might be another thing to worry about. I think ultimately, again, if you're washing your hands, if you have hand sanitizer, you're mitigating a lot of that risk, but that could be something to consider as well.
And some of those things might get covered or discussed too on our Thursday session with Kathy Zeman when farmers markets.
Yeah. So basically, it would be great if everyone could help us promote this content. We've been getting lots and lots of questions, so the more that we can help get the word out about these webinars, the better. You can find the local foods college on Facebook or tweet, and then, like Anna said, join us on Thursday for the farmers market call, as well as next week's sessions about planning for basically uncertain markets and the wholesale response. And Anna, I think, is going to be emailing you an evaluation form. So that's a place where if you have things that you would like us to focus on in future sessions, you can suggest topics there. And then this will be recorded, so you can share the link with wherever you watch it again. So that's it. Thank you, everyone, for joining us.
Thank you.